The new rules say that tobacco specialist retailers will have to fit all of this into this. So about 60 square meters of display space have to be reduced to 4 square meters. That's about 1,400 products that have to fit into a space that can only carry up to 300 products. The end effect will be that someone like British American Tobacco will be in a position to monopolize the market.
They've got about 90% of the market, and their one brand has got 50% of the market. So what you would find is that that brand would be displayed prominently in all outlets because of the limited space and because of the convenience of being able to access it. The non-dominant brands or the smaller players will end up being under the counter or behind closed doors because they're not as popular. So the net result is that someone who's got 90% of the market might increase to 92 or 93% of the market, and of course can then dictate the market and dominate the market and literally monopolize and do what they like with it.
They say the rules will push up the cost of tobacco products, forcing more people to look to the black market for cheaper alternatives. The tobacco black market already has 30% market share in South Africa, and the Tobacco Institute of Southern Africa estimates the illicit cigarette market in South Africa to be worth about 5 billion rand in unpaid taxes. Government currently collects about 10 billion rands worth of taxes from legal tobacco sales.
The incidence of tax on cigarettes is 54% of the retail selling price. So if you take a company, a cigarette manufacturing company, 54% of their partner is the government. That's the taxes involved. So that's really huge, and it's a legal business. It generates over 10 billion in taxes, and it's not growing, but all that they do is when the consumption drops, they increase the taxes. So they keep their income. So they're kind of playing a very dangerous kind of game because they want the income, but they want to reduce the consumption.
Tobacco dealers say they asked the Department of Health what research had been done to understand what impact the new rules will have on the economy or even on people's behavior. The answer was none. We also asked the department the same question, but did not receive a response. Gunter Deutsch, SABC News.